completely Wi-Fi, and we do rounds on a computer. We don't have any physical notes there. Our physician assistant comes with us, and he's in either physician assistant or our junior doctors in the data in their respective this one. And the orders are also given there, in the blood tests or whatever tests are also ordered on the system. This is how the notes, morning rounds, evening rounds, then so on and so forth. Each thing has a particular box where you put it in. We order tests also accordingly, whatever is required, and then this automatically is picked up by the lab, and the blood is sent to the lab, and the reports come. Next slide. Radiology also gets marked from there. They go in ultrasound, echo, EMT, all these things can be marked from the IP also. Gets done and then comes back. Physiotherapy department, a lot of our patients have frozen shoulders, low back aches and things like chiroarthropathies and things like that. So we have like a fairly set up acute physiotherapy department. And he also gets to enter his notes. Physiotherapy is becoming more important for us because we do a lot of bariatric surgery procedures. I mean, we have like a diabetes wellness clinic where our obesity patients initially gets inducted into like an intensive lifestyle program and all that, and some of them move on later to a bariatric surgery program. We've done about 10 as of yesterday. In a period of 3 months we did 10 cases already. Finally, the discharge, and when the patient has to go, we don't have much work to do. Just it's all there because we would have fed in all this data before, during admission and during rounds. So discharge is like just 2 minutes for us. We just need to because it automatically all the data comes to the discharge summary sheet, and we just need to put in the advice. So it doesn't take much time for us to prepare a discharge summary, and we do it during rounds immediately, as and when on the trot we get the discharge summary done also. This is the billing. Then after the billing, after the discharge summary is ready, the billing gets done. Then the best part is that you can just, if at any point you want to see, okay, how many of your patients were type 1, how many of your patients with type 2 had let's say neuropathy or severe hypoglycemia or this thing, all that data you can pull it out as and when you want it. And that's how I put this presentation together actually. We just pulled out our looked at our data more closely. And also, if at some point you want to know, okay, now you are doing a study on an obesity agent, and you want to call for patients whose BMI is above 35. So you just need to give a age limit, BMI limit, age limit, and then you'll get a full list of how many of your patients fall into that criteria. And then you easily go back to their phone numbers, and then you can call them in and ask them if they are interested in the study and so forth. This is like a pharmacy. What is the percentage of your prescriptions that have been realized in the pharmacy? How many of them have gone out and so forth? Mostly from a private hospital point of view. Then this is a great thing because we are getting lined up for our NABH accreditation. So patient waiting time, when did the patient come? How long did he spend before he saw the patient, before he saw the doctor? How long did he spend after he saw the doctor till he went, what time did he collect the prescription and so forth. So all those things. So each doctor will be in a sense audited to see what was the waiting time for that particular doctor. If the waiting time had gone long, if it was a long period, then obviously we need to find out why that is. We need to tell him to speed up a little bit and so forth. So it's a pretty useful tool that we can use. So, basically what we spoke about was implementing an electronic medical record system in a hospital, and obviously it has not been easy, not been without hiccups. And, we've had, but we stuck with it. We don't have a medical records department as such. We have like a big server, an IBM RAID prices. I wish I could show you a picture of that. Huge one, and all the MRB is in the server, and we back up also. So we don't have a medical records room at all. We do even the surgery notes and everything goes into